of children to actually put through their clinical trial. So an outbreak of meningitis in children occurred in Kano in Nigeria, and all of a sudden there was a research team on the ground carrying out a controlled study of this particular intervention. But in the years that have gone by afterwards, it turns out that they modified the protocol in crucial ways, which made it highly questionable as to whether the data was really relevant to the question they were seeking to answer, but also identified a number of ethical problems in the ways that the people were informed of what was happening, whether parents actually knew that this was an experimental drug. And so this is an example of some of the things not to be done from an ethical basis. And it raises current questions about how Ebola is going to be addressed in terms of the experimental treatments that are currently available with little or no human data available to guide the decision makers. How should things proceed here? Can they be done in ways where the data is collected to at least provide better information in the future? And one of the things that's been following the Ebola situation that has become really clear with the way WHO had to pull together ethics experts to examine this whole area is that, again, very little has been done in the preceding years to develop clear guidelines on how these types of situations can be addressed ethically in order to ensure that survivors are where the focus is with experimental drugs or with conditions that have very little evidence-based interventions, and that because of that, things are once again being done in a real rush in a situation without clear guidance. This raises then the third area, the question of how you select people to be involved in the research in a disaster setting. And the underlying ethical principle is that it needs to be done fairly and justly. Part of the concern with the Trovan situation was that these were people who really had little other choice. They had very little health care in the area, and they were being provided very little of kind of basic interventions for meningitis. And so all of a sudden, these researchers showed up from another country who seemed to be there to take care of these patients. But unfortunately, most people didn't realize that it was an experimental intervention that was being used. In similar situations in disasters, is this a study that needs to be done in a disaster setting? Maybe somehow the needs are bigger and people may be willing to take on the research risks of an unknown intervention, but that in reality, this study should be done in a non-disaster related setting prior to being carried out. Are all appropriate groups being included? I think in general research we see that women have often been, been left out of studies for no other reason than the complexities of having to deal with risk of pregnancy or other types of issues. And this creates a huge problem then with having enough evidence to make reliable or to give reliable information and advice to all groups of the population. So the general guiding principle here should be that those who are in need of the intervention should be involved in the studies that are being carried out ahead of time. And then on the kind of other end of things, that those who take the risks to be involved in experimental conditions should also benefit from the fruit of those results. And so as a result of, again, past problems with the development of HIV drugs, primarily in Africa, but also in Asia, there has been a change to the Helsinki Convention, or the Declaration of Helsinki, in the area of this benefit sharing, so that now there is an ethical responsibility on researchers to ensure that the fruit of the research that's done is actually shared with those who took part in the research to begin with. But that raises many other complexities in terms of how it's actually going to be done. And this becomes a major issue in terms of the incentives that may be provided for people to get involved in research studies as participants. The cartoon has the researcher there presenting to this group of homeless people with lots of little drinks in their brown paper bags, saying that you get $50 per blood specimen. Of course, that shouldn't affect your decision to be involved in the research. And of course, it highlights the fact that $50 to some people maybe no big deal. That's just spare change, and that's not going to incentivize me to take a risk of putting some weird stuff into my veins or into my stomach. But in other contexts, $50 is a year's salary. $50, or even the fact of getting anything from somebody in a white coat, is a huge incentive. And so in a humanitarian context, there's been what's been described as the humanitarian misconception. Do people get involved as research subjects because they think this is a way to receive aid, or that this is a requirement, that if I don't sign up for this research study, they're going to take my name in some way and I won't get a bag of food or a bottle of water the next time I'm coming for the regular aid. And so this puts an ethical requirement on those who are doing research to make it very clear that this is research and that this is voluntary. You are not going to be required to be involved, and that is first of all then considered from the position of the participants. What I may view as a risk may not be the same as what somebody in a different context may view. I may have no perception that the person may be shunned if they do or if they don't get involved in this research. That maybe the fact that they're collaborating with people who have come in from outside could be viewed as a very dangerous thing from somebody because I don't understand the context or the whole situation. And so this is where, particularly in a social science context, where a lot of research is being done, much more than medical intervention types of studies, that people have got to be very careful about the ways that somebody talking about a particular topic can be perceived by the others around them. And so, for example, going in as a researcher into a refugee camp to do a study about sexual abuse in the camp could actually put some of the people at huge risk if the authorities or if those who are involved in the abuse were to find out that somebody was even interested in finding out about the study, never mind actually talking as part of the study. Another thing as well is that the risk calculation is going to vary over the course of the disaster. And so, for example, a chart shows that in Haiti, after the earthquake, that the needs in terms of there's the medical needs of trauma care went down after about a week very significantly, whereas the needs around non-trauma care started to increase as more people started to come out and talk about the mental health issues or talk about the lack of clean water issues or other diseases that were starting to develop. And so this has to be taken into the context of the risk-benefit ratio. Another thing that I think is very important in a disaster setting in research that is often not as relevant in non-disaster settings is to consider the risks to the researchers. That sometimes somebody going into an unstable situation, whether it's geologically unstable or politically, militarily unstable, puts researchers at risk that they're not aware of. And this is particularly important as more established researchers may be encouraging or pushing young researchers, research students to go to certain regions to do really interesting, highly publishable research. And yet the young researcher may be forced to take risks that they would not otherwise like to be taking. This could be everything from just a regular fear of going to certain parts of the world or it could be a realistic risk of putting somebody into harm's way if you're sending them into a conflict zone. And so the whole hierarchical issues within research structures needs to be taken into account, and again ensure that a young researcher is going to do a certain project because this is what they want to do, not because they feel coerced into doing so. So in a stable situation, the importance of research ethics committees or institutional review boards, research ethics applications has been strongly recognized, and I think unfortunately sometimes it's been used that ethics is just about getting your research ethics approval and somehow getting through the application process. But apart from the fact that I think ethics is much bigger than that, I think it's also important to do the best to have an independent review of these projects going into disaster settings. That sometimes researchers may not really have an important sense of just the types of conflicts of interest that may exist with disaster research. So, for example, has the humanitarian aid been separated out from the research to a sufficient degree? But there are other issues then about the design of the project and whether it's to fulfill more of the needs of the sending agency, the fact that they have to report back to their funders about the evidence for their interventions, or is it really about caring better for the researchers, for the survivors? There can be other types of conflicts of interest if the researchers are under the care or under the protection of various military groups. That can raise an association that can sometimes be beneficial, but also sometimes can put researchers at risk, particularly if they're viewed to be associated with one side or another of an armed conflict. Independent review, though, in a normal setting, one of the criticisms of research ethics is that it often takes a long time to get approval, with people coming back with all sorts of nitpicky concerns. I'm the chair of the Research Ethics Committee at our university, so I am involved in all of this, but I also realize that there are limitations. There are ways that we need to improve, that actually research ethics itself needs to become much more evidence-based, which is something that Mike and I have been talking quite a bit about, to make sure that what we think we're doing to improve the ethics of research actually is having the effect that we would like. But nonetheless, I think there are ways that independent review is important for research projects, especially in a disaster context, but that there may have to be adaptations of it. Sometimes you can't, or clearly you can't wait a couple of months to get a project approved before going into a disaster setting. But there are ways that preliminary approval can be developed. Médecins Sans Frontières has developed a research ethics protocol where the main components of a research project can be evaluated carefully and thoroughly, pre-approved, and when a disaster hits, it can then be very quickly adapted to the context of the disaster and then done in an appropriate way. But there's a way that it's important to balance the pressing needs against the importance of being carefully reviewed. So you may be aware then of some different approaches that are being taken in this area that are starting to develop clearer guidelines in this whole area, and as these slides will be available later, you'll be able to take down all these details. But MSF has made all of its research ethics procedures available online. There's a new ethics framework that's been developed for a group called R2HC, which in the UK is the Wellcome Trust's method of funding research in the humanitarian context. And then also the group in Asia that was set up after the tsunami to look at research ethics has published their draft guidelines, and I'm working with them on the moment to identify funding so that we can actually have these validated and put into a more or a more concrete context and get it articulated around the world. The sixth principle is that of informed consent, and this is where you'll probably be very familiar with the importance of this, of engaging with the individuals ahead of time to ensure that they know what they're getting involved with and that they agree to doing so. Voluntary consent is essential, but again it raises challenges in terms of the languages, where in one particular context there may be dozens of different languages. How do you get this information translated appropriately? And so there are initiatives being carried out where they involve members of the community to actually become part of the research team so that they can both learn about the research process, be part of a development of a local research infrastructure, in addition then to having the local languages so that they can explain very carefully to the local people what exactly is being involved. And then I think ultimately what we're basically talking about is research for participants, but in a humanitarian context, I think it raises some particular additional issues. It's important to keep monitoring participants as they're involved. There's a whole category of research known as parachute research, where the researcher drops in, does what they want to do, and then they're gone before somebody has a chance to figure things out. But it's important to have an ongoing way of developing a means of monitoring how people have done and how has the research affected those people. Has it had a positive impact? There are issues around privacy and confidentiality. There was research done in some Thai refugee camps where the researchers interviewed women about their stories in the refugee camp, took photographs of them, and one of the participants, or none of the participants found out what happened to all of this, but one of the participants ended up migrating to Australia, and here found her photograph in some publicity being used to raise funds for the NGO that had been behind the research. And this led to a complete lack of trust among participants or among members of refugee camps, because they felt like their stories were not being respected. They were being gathered and taken, and this is interesting. I'll just keep going like nothing's happened. So then is there deception involved? And if there is, this has to be justified. It should be very, very carefully justified.